going through natural disasters really does a psychological impact as well. And joining me to talk about what WHO is doing to help address this is Dr. Shekhar Saxena, who is the head of our mental health and substance abuse program. And of course, Elizabeth has come back to join us. Shekhar, let me start with you. Just a few weeks ago, in fact, it was shortly after the earthquake in Nepal happened, we put out guidance to help health workers who are working in emergencies address mental health psychological issues, even if they weren't necessarily trained in that area of work. Can you talk a little bit about this guide and bring our viewers up to speed on it?
Thank you, Christy. And you're right. A number of people face psychological problems and social problems. And unfortunately, some of these countries which did not have good expertise on mental health in any case are now having larger needs and decreased capacity. So WHO has given some guidance and actually an instrument by which the usual humanitarian workers and health workers can actually be trained very quickly to provide the kind of psychosocial help that is necessary for the populations. And this can be done quickly, this can be done efficiently, and goes a long way actually in providing help to people who need it now.
Can you talk about what are the most common types of mental health issues that you see in emergencies?
I'm sure everybody has heard about the post-traumatic stress disorder, but I just want to clarify that that's only one of the conditions that comes up. Much more common are the usual depression, the anxiety, as well as some of the other more severe disorders, including psychoses, a recurrence of epilepsy, and many other conditions. So the burden is large, and the numbers of people affected is extremely large.
And why is that such a high priority in emergencies? What does addressing that enable us to do broader in emergencies?
We always say there is no health without mental health, and this applies equally well to emergency situations. But what is really important is to say that if you look after the psychosocial and mental health of people who have just undergone some very severe stress, you actually help not only them, but you also help the other health spheres. They look after their health better. They actually can recuperate better. They look after the economy better because they can be employed. They can actually lead to productive life of themselves and communities. So it's a method by which you help people to look after themselves and the country better. So it has double advantage.
Thank you. Elizabeth, let me come to you. Just a moment ago, you were mentioning what a big issue this is in Syria, where you work regularly. Talk about what you see there on the ground. I can only imagine the traumatic events that people have lived through. Well, what do you see? Elaborate on what you were saying earlier.
What we see and what we hear is quite clearly that every family is affected. They have serious problems with anxiety and grief because most of them have lost one family members or have someone injured or have sent their son or as the daughter as a volunteer to try to help in a community where there is insecurity and violence going on. So living with violence under these difficult circumstances is affecting more than half of the population where they really have mental problems in terms of depression and anxiety. And on top of that, we have today in Syria around 600,000 with severe mental disorders, which has also increased from before, where it used to be in 1 to 2% of the population. Today it is like 3 to 4%. And there are also some good aspects of the crisis, which is that before, mental health problems were very much stigmatized, and mental health institutions were separate from the normal treatment where you had physical illnesses. But what is happening today is that WHO has been able to actually promote with the Ministry of Health a different approach, also with the local health authorities. So we have already started and we have actually rehabilitated 2 units in the normal hospitals, if you would like, when I say normal, with physical care, so that there is no difference between mental care and the physical rehabilitation that is required. So this has been a good thing. We have also rehabilitated outpatient clinics In the beginning of the crisis, we focused very much on the psychosocial support aspects, and the social aspect was working very well, but we didn't really have any place to refer those who had problems with their mental health. And this is what we have focused on. So with these guidelines that has been produced by WHO, the GAP, mental health GAP guidelines, we started to train and sensitize the physicians working in Syria to mental health problems and how to treat the patients when they had these conditions referred to them. And the good thing is that we have trained now more than 600. This is not enough, but we are focusing on it, and we are receiving support from headquarters, from my colleague here on my right side, and also from the experts from the regional office. And we have also started to train psychologists. So we have 36 we have trained, small scale, but we hope to see this. But the most important thing that we are focusing on is to get it out from the central level and down to be community-based, so that we can meet the people where they are and talk about the problems that way they have. And I can just tell you that I met a woman who was thanking me very much for the community care, because the son had been referred. He hadn't slept he had been injured he hadn't slept for 3 weeks because he was actually disturbed by the pictures that he saw in his head after that. He got good treatment for his physical care, but he needed really rest and care for his depression. And this had been difficult to find even before the crisis in Syria. But now this is something we are focusing on, is to try to help the individuals with their problems that they have. And we see that half of the population actually needs somebody to talk to, they need proper care, they need sort of also medication for their anxiety, and this is what we are trying to establish.
It's really the perfect illustration of how a guide like this is so useful in our work in the field. It's always nice to have you with us, Elizabeth, and it always amazes me that somebody that works in such a constantly stressful place in a situation looks so refreshed and rested every time I see you here. Thank you for coming by, and thank you for what you do.
Me. Thank you.
Shekhar, you can sit tight for just a second, Elizabeth, but Shekhar, I want to keep you for just a second because there's a resolution here this week. And the way that we're set up here in the middle of the Palais means that we can snag anybody that comes by and ask him anything we want to ask about what's happening at the World Health Assembly. So if I could ask you about the epilepsy resolution, is that okay?
Yes.
All right, terrific.
But Christine, let me just say a word about the guidance that we provided. This is done by WHO and UNHCR. So actually there are two international organizations behind that, which actually increases the quality and also the scope of its application.
Absolutely, and they are certainly major partners working in many of these emergencies. So yes, that's a very good point to bring up, UNHCR. All right, let me talk about epilepsy for just a moment before I lose you. More than 50 million people around the world, if I have my numbers right, have epilepsy. More than 3/4 of those living in low and middle income countries. What is the resolution that's on deck this week trying to achieve?
This World Health Assembly is discussing epilepsy as a disease. It's putting it higher on the public health agenda, and it's specifying the kinds of actions that countries need to take and the kind of actions that WHO needs to take. It essentially covers giving epilepsy a higher billing on the country's agendas, strengthening governance, making essential medicines available to people, and training primary care providers in providing the kind of treatment that people with epilepsy need. You mentioned 50 million. Most of them live in low and middle income countries, and they need help now. And unfortunately, that help can be given by the general doctors and nurses. They don't need to go to the specialist. 85% of people with epilepsy can be treated with proper training and availability of drugs by the doctors and nurses who are right there in primary care. And I'm very happy to note that this resolution is proposed by China, which has actually a very large amount of experience in this. We have worked with them for the last 20 years. And the story of China for epilepsy is an example to be taken by all countries. And this is something that we're looking forward to, having this resolution and then assisting countries in treating people with epilepsy and changing their lives by this treatment.
Looking forward, I mean, really, this has been quite useful to help us understand that dealing with mental health issues actually really is vital for moving forward health in general. What other major issues, looking forward, would you say there are in mental health that we're planning to start addressing? What's on the horizon?
Well, I am happy to note that there is so much interest on mental health because this has often been ignored in the public health agenda. We also have a progress report on the mental health action plan that was passed by the Assembly in 2013, and we are reporting how well or sometimes how not so well countries are doing. One of the issues is suicide. You know that mental health action plan has an indicator on suicide rate, and we published just last September the World Suicide Report, and we're very happy to note that a number of countries are establishing their suicide prevention strategies and making very good attempts in preventing suicides in their countries. I must say that no rate is acceptable. No suicide is acceptable. Any rate is too high. So all countries, whether they have a high rate or low rate, need to take steps towards preventing suicides, and they're doing it.
That was one of the most important reports we had last year. Quite useful. Listen, let me thank both of you. I've got to let you go, but let me thank both of you for what you do and really bringing to the attention to us the need to treat an injured mind as well as an injured body.
Happy to be here.
Yeah.
Thank you.
Thank you. Lovely
Christine,
to
for
see
setting
both
up
of you.
this. Thank